Hey everybody, welcome to another episode of EMS Leads. This is going to be episode 3 of the education section. We're going to be talking about EMS Health and Wellness this time. This is a topic that's very near and dear to my heart to those of you that know me. Fitness and nutrition and everything like that's super important to me, and I really care about the wellness of my EMS providers that I work with and train, and just think that this is a topic that's very underdeveloped in the EMS community, which is also just really surprising given how robust the knowledge is regarding other first responder agencies like firefighters and police officers who have very strict guidelines they must follow, but in EMS there's really not. So we're going to go through just some kind of evidence-based medicine regarding this, and then just some ideas that those of you listening can kind of use to evaluate your own agencies, and maybe some suggestions to take back to your agencies as you try and promote this. So we're going to talk about some statistics regarding EMS wellness, maybe some potential barriers, and then specifically get into fatigue and kind of sleep deprivation. And then I've given this lecture quite a bit, but now, of course, we have to bring in COVID a little bit, and then some possible ideas, and then just kind of quickly about my philosophy, and then moving forward as a medical director or provider, kind of what we should be taking back to our agencies. So first, we kind of have to start with a definition of what is wellness. So wellness is defined as physical and mental well-being of an individual. It involves their sleep, hygiene, some sort of exercise regimen, and proper diet. Those who rate themselves as having good wellness have lower death rate than those that self-rate as poor by a factor of 2.9. So basically, if you think that your wellness is good, you have a 3 times better likelihood of surviving than those that rated poor. And then EMS workers rate their health as poor less than the normal population. So when you survey EMS providers, they are far and away more often saying that they actually think they have good wellness. So we're going to evaluate if that's really true. So before that, I wanted to just explain that even for the general public, the CDC has gone out and actually given some recommendations regarding exercise for laypersons. So the CDC physical activity guidelines were issued by the U.S. Department of Health and Human Services, and it complements the same department's dietary guidelines for America. And then that one was also a joint venture between the Department of Health and Human Services and the U.S. Department of Agriculture. So these two documents provide guidance for the public on importance of being physically active and eating a healthy diet to promote good health and reduce the risk of chronic diseases. So this is for everybody. And if you go through the whole document, which is available on Google, they've broken it down by age. So preschool age, children, adolescents, adults, older adults, postpartum women, and then those with chronic health conditions and disabilities. So they describe this document, these physical activity guidelines, as science-based guidance to help people ages 3 years and older improve their health through participation in regular physical activity. It seeks to promote physical activity as it fosters normal growth and development, can help people feel better, function better, sleep better, and reduce the risk of a large number of chronic disease. So the government is telling its citizens physical activity is very important. So without going into every breakdown, because the majority of our EMS providers would be in the adult section, it says to move more, sit less through the day, and then include any sort of moderate to vigorous activity. And so then if you look here, it actually has goals of moderate or physical activity, how much you should do a week. And you want to spread it out through the week. So obviously you don't want to do 3 hours of activity in one day and then do nothing else the rest of the week. And then you also should include some sort of muscle strengthening or resistance training. They didn't really break down that it has to be some sort of weight training. You can do body weight stuff, calisthenics like sit-ups, push-ups, that kind of thing. You just want some resistance training that's requiring muscles to contract. And then obviously these are just the goal. And so any time more than the proposed activity only benefits you more. So examples of moderate activity would be walking briskly at 2.5, 4 miles an hour pace, which is essentially walking a dog that's moving pretty good, playing doubles tennis, raking the yard, And then any sort of vigorous activity would be jogging or running, carrying heavy loads upstairs, shoveling snow, or any sort of strenuous fitness class. And this document even acknowledges that many adults do no vigorous activity during the week. So that's just for the layperson. So the next question now, understanding that the government has told us, hey, physical activity is super important and part of an important, well-balanced fitness and health regimen. And EMS providers, as we saw, say that they have good health. Now the question is, do EMS providers seem to be more well than the general population? So before we break it down to EMS providers specifically, let's step back and just look at civil service wellness. So in law enforcement, there are quarterly PT assessments that have metrics based on the law enforcement officer's gender and age. And then tactical teams often have more rigorous standards, but overall, they still just have to, at minimum, focus on the LEO recommendations. So within the fire department, there are also regular drills and PT requirements, and they have mandatory workout requirements in many services. The fire service near us, during their academy classes training, in the beginning part of every session, they have mandatory workouts with a complete breakdown of stretching, the weight training they'll be doing, the cardio, they'll be doing everything. And there's even requirements at this agency of what they can or cannot make at mealtime and what kind of groceries can be bought. So obviously, law enforcement and fire department, both very active services, have very strict requirements. So the fire department has a huge focus of wellness because of their job. Within the firefighter rehab requirements, there are specific vital signs that providers have to monitor. There's even components of what the rehab food and liquids can be. So when I took my EMS boards, there were questions about what the ratio of carbs to protein to fats should be within recovery drinks for firefighters in rehab. And so some of the big recommendations that have come out of firefighter rehab, which really should be thought about in any sort of strenuous activity rehab. You want to avoid energy drinks as a source of caffeine, but then within caffeine, you really shouldn't have more than 400 milligrams a day. And then the focus is less on electrolyte replacement and more about water. Within the NFPA guidelines, 1583 is completely a guideline based on the health and fitness of firefighters. So as you can see, there is a huge focus. So this table is actually the Iowa Law Enforcement Officer Physical Standards. So you can see based on age at the top what the requirements are of each of these exercises that you see on the far left. And so when you see the slash, that separates by gender. So the left side of the slash is the male requirements, the right side of the slash is the female requirements. So if you look, when you are over 40, in 1 minute, you need to do 18 push-ups as a male, 29 sit-ups, which is one sit-up every 2 seconds, which is not very difficult, but again, regardless of the difficulty, as obviously it will be very individualized, the point is that there is someone keeping track and there is a goal that you have to meet each time. So now getting back to EMS. So what are the requirements for EMS? Now, EMS carries just as many heavy patients as fire department. They often have to move up and down stairs. They have to carry lots of equipment. Depending on where you work, if it's cold out, you might be wearing extra layers. And obviously it's not as heavy as turnout gear, but you're also carrying a monitor and other sorts of medical equipment. You're obviously working a very active job. However, there are no official EMS recommendations regarding fitness requirements, nutrition, what you should avoid, official recommendations on shift length, fatigue metrics, rest hours, etc. But as we talked about, they do the same physical labor and also have some worse constraints in that they often are, depending on your system, if they're in some sort of dynamic deployment, they may not be able to sit down at a station and make a meal, and they're basically eating out of what they brought or out of gas stations or fast food. In addition, they're also sitting for long periods of time. So looking at statistics based on the literature, when you look at EMS providers overall, 75% are considered obese by their BMI, 50% have a sedentary lifestyle, And in that, they would not meet the minimal physical requirements based on that CDC physical activity. And then 15% of them smoke tobacco. So these are three criteria that all three have been linked to a lot of comorbidities and shorter lifespan later. So then when we go to different studies that have been done, Bryce et al. Did a study to characterize the key health indicators among EMS. And so they basically used 450 providers in North Carolina that were all EMS providers. And so when they would drop patients off, if they, at this hospital that was doing the study, they would go to the study area. And then if they were willing to participate, they would have their height, weight, blood pressure measured. And then they would fill out a questionnaire that involved their demographics. So gender, age, how long they'd been on the job, et cetera, their activity level, which they defined for them, their alcohol consumption, smoking, and medical history. And so it was about 74% male, 86% of them were full-time EMS providers. So a pretty good representation, I would say. And so those that were considered overweight or obese based on BMI, 80% of these providers were, compared to the national average of 71%. 65% measured a high blood pressure, but only 18% of them actually had a hypertensive history. In terms of drinking alcohol in the last 30 days, 55% of them had, and 57% of the nation have. So that's about standard. However, when you look at heavy and binge drinking, 22% voiced heavy drinking, 28.8% voiced binge drinking, compared to 6 and 18% respectively. So a vastly higher number are heavy and binge drinking, with then comparable regular alcohol use like the nation. Pretty similar smoking statistics to the nation, and about the same amount met the CDC activity guidelines. So overall, these are not encouraging numbers. And this is one of the main studies and one of the only studies about EMS providers that really does put forth the assumption that no, EMS providers are not more well than the general public, even though they feel that they are. So why are there no EMS guidelines? Why isn't there some sort of governing body stating how do we keep our EMS providers safer? One is a monetary concern. It costs money to do health incentives, gym membership discounts. Agencies would have to spend money to do health screenings. In addition to money concerns, there's sometimes not an acknowledgement that there is a problem. As we just found in questionnaires, EMS providers are saying they're well. However, they're clearly not. So maybe they have low recognition or lack of education. They might be indifferent and just don't care, or they just don't even know where to start. A lot of people just do not have a lot of knowledge on where to even start, and it can feel really overwhelming. You could be too busy, or it just, you see what the end point you desire is, and it's really hard to know how to even take a baby step. The final one would just be lack of buy-in. You know, in EMS, we're in a culture that is very resistant to change. It's very difficult to get out of the "this is how it's always been done" mentality. And EMS providers often have a lot of things going on, and based on their shift scheduling, they often don't have a lot of time in between shifts, or it's very valuable time and they don't want to spend it working out or having to shop for food or meal prep, that kind of thing. So why is it silly that we don't have guidelines? Well, in terms of the monetary concerns, the Wellness Council of America has found and done calculations to show that every dollar saved in wellness programs of an agency actually helps employers save $2 to $3 in healthcare costs. So the healthier you are and the more we motivate you to be healthy, the more the agency will save on your healthcare costs. This is important because EMS providers suffer more work-related injuries than the average public citizen, and they're more likely to miss work from work-related injuries compared to fire departments and police departments. This is further important because both of those, as we said, have strict guidelines. So now let's move into some specific metrics of wellness. The most obvious and most robust in terms of literature that's out there is fatigue. So fatigue is defined as a general lack of alertness and degradation in mental and physical performance. Now, this is very concerning, and those are all very concerning findings in someone that's driving a very expensive ambulance with often multiple people inside, and often at various times of day. So there's three types of fatigue. There's the transient, cumulative, and circadian. So transient obviously is not lasting long and is corrected once you've slept. So this is just someone that has to get up early or is woken up by something. But then when you get a good night's sleep the next night, you feel much better. Cumulative is brought on by repeated sleep restrictions or extended hours awake across a series of days. So most of the residents in the hospital are suffering from cumulative fatigue. We have a 6-month-old in our house, and so we are just getting up over that hump of the cumulative fatigue as she's starting to sleep better. And then the circadian fatigue is fatigue associated with disturbances in your circadian rhythm. So this is often jet lag and certain types of shift work that might be cyclical. So typical acute fatigue is extreme sleep restriction or extended hours awake within 1 or 2 days. This is often fixable and transient. So the literature agrees that most adults need 8 to 9 hours of sleep in 24 hours to perform effectively. Obviously, when you have an accumulated sleep debt, which I think most adults would say they do, they often need more than 9 hours of sleep a night to recover. However, this is very difficult. It's also very difficult to sleep during the day, and there are serious risks of being fatigued and making a mistake. And these risks increase the longer a person has been awake and is working on a task. So they've actually found when an adult is awake over 21 hours, they have the mental faculties that is equivalent to a blood alcohol level of 0.08, which in Iowa is the legal limit before you can be arrested for drunk driving. So now we have people that have potentially been awake this long, as like residents in a hospital who are on call, who are having to make serious decisions and split-second decisions. And so it really just puts it into context. So based on different questionnaires and surveys, workplace fatigue affects over 50% of EMS providers. It's linked to injury, patient care errors, and adverse events, as we talked about. And there's really no training given in how to mitigate the effects, despite fatigue being a large component of safety management. You know, shift work causes disrupted sleep and circadian rhythms. It worsens fatigue. And there's just this push forward that fatigue management should be thought of as a big component of safety management. And there are other industries that use advanced processes for fatigue detection and mitigation. And it might be time that EMS starts to tackle this as well. So Patterson et al. Did 2 huge studies regarding fatigue in EMS. And so the first one just really identified the problem. And the second one then attempted to answer 7 questions about EMS fatigue to try and develop evidence-based guidelines for risk management regarding fatigue. In that study, they ended up with 5 recommendations. So the first study, the objective was to characterize the sleep quality in association with severe fatigue in EMS providers. So 3 surveys were given to people, and there was about 120 providers. 35.4% worked 8-hour shifts, 42.7% were obese, 59.6% had at least one disease, like diabetes, asthma, some sort of chronic thing. 44.5% had severe mental physical fatigue. The results of the study suggest that the sleep quality and fatigue status of EMS workers are at unhealthy levels. The health and safety of the EMS worker and patient population should be considered in light of these results. So this study sounded the alarm that, hey, EMS providers are suffering from serious fatigue and there is a potential risk to themselves and the public. So the next study now in light of these results was, can we answer certain questions and provide evidence-based guidelines and recommendations? So these are the questions they asked. Are there reliable, valid instruments to measure fatigue? Do shift scheduling interventions help mitigate fatigue and improve sleep? Do any of the following mitigate fatigue or improve sleep? And that's talking about workers' use of countermeasures, which would be like caffeine, use of sleep rest strategies or interventions, so napping, fatigue training, model-based fatigue risk management, and task load interventions. So they were able to come up with 5 interventions, 5 recommendations. So using fatigue sleepiness survey instruments help monitor and measure fatigue. So this is used by highly reliable organizations where failure is not an option. For example, the flight industry uses very strict fatigue guidelines, which we'll talk about here in the next slide. But survey instruments are very useful. Any sort of flight service, so HEMS, anything like that. Sorry about that. Have very strict survey instruments that they have to fill out. And I remember when I flew as a resident, in the morning, the providers and the pilot always had to fill out beginning of shift fatigue surveys and intermittently through the shift and at the end, and that would decide if they were able to fly. So if they did not meet a certain score, when a flight came in, they would have to defer the flight. I never saw that happen, but that was the concept. So in terms of shift length, they did provide the recommendation that shifts should be less than 24 hours. Many studies were measuring outcomes on shifts of varying length, and they found across the board that worse outcomes occurred when shifts were over 24 hours. Now, there was no real support that all shifts had to be 8 hours, especially when they were comparing 8 hours to 12-hour shifts. But they did find that 24 hours really seems to be then when there's concern of damage. And the reason you can't be stuck at 8 hours is it depends on your agency. It depends if you have other jobs. And so, there's desires of the staff. I know some staff members in our agency prefer to have 16-hour shifts because then they work less often. There's also some cost to the agency and the provider, both of time and money when you have different length shifts. There's certain practicality elements, and then the effect on the system of shift turnover, and then how do you recruit? So regarding countermeasures, they recommend having caffeine available. The big things here is the employees have to self-regulate. Something they couldn't find was, does the type of caffeine matter? I think there's more evidence based on the guidelines from the NFPA that we really should be staying away from energy drinks just because of some of the other ingredients. And often some of these newer energy drinks are already going to get you over the 400 milligram caffeine limit that's really been recommended. They have found that caffeine improves function, but there are some long-term risks, that essentially is a stressor and a stimulant. So it might improve your alertness and reduce sleepiness and improve your performance for a time. But there can be some concern about sleep inertia, that kind of thing. And so, if you're awake, and then suddenly you have a window to sleep, you've kind of lost that because you're still under the influence of the caffeine. And then maybe by the time you're ready to take a nap or sleep, it's too late and you're busy. Another concern with caffeine is, what about access? What if an agency is, constantly moving and they don't have a main base where they can be drinking coffee, making coffee, that kind of thing? The study did recommend getting naps in, but again, you have to keep in mind, what is the optimal nap time? Because you can't sleep for 3 hours. What if you're constantly being woken up for calls, and then sleep inertia again comes in and you're very drowsy and ultimately have slower reaction time? They found that ultimately the best time is about 15 minutes to 2 hours, somewhere in there. And so really you want to sleep in increments of 15 minutes. So if you have a certain amount of time, sleep 15 minutes, 30 minutes, 45, etc. And that's really where you're not going to run into too much sleep inertia, and you really shouldn't get into that deep sleep, but you're still getting the benefit. The other question, though, is what's the public perception of this? So I've been in fire departments where they're not allowed to go into the common room or the restroom where they have the recliners, not the bathroom, but the room where they can rest and relax. They're not allowed to go into that until after 5 p.m. because at that point the officers have gone home and it's considered business hours are over. The other thing would be a tour of an EMS agency. If all the providers are in their rooms sleeping and it's 2 p.m, that can make the public kind of confused when they don't totally understand, what EMS does. But then there's also a little bit of a cost to the agency to have rooms and beds and mattresses and laundering all the sheets. But then what about those EMS agencies that are constantly on the move and aren't station based? So these are all things you have to think about. They do endorse that you should be giving some formal education. There's a lot of formats to do this, but they found there is an association with education and better outcomes in worker sleep. It kind of increases people's awareness of sleep apnea, sleep disorders, that kind of thing. There's not really any guidelines on what the depth, breadth, or topic should be, but they do think at orientation and every couple of years there should be some sort of formal sleep and fatigue education. The last couple questions they asked, there really wasn't any good guidelines or answers they could find. So just talking about those highly reliable organizations, this is just showing you how strict the FAA is on its pilots. So they have to have 9 hours minimum rest prior to duty. And then they can have 16-hour duty period between rest periods, and then flight time weekly. They have to have at least 30 consecutive hours off duty, monthly 100-hour max of flight time in 28 days, and yearly 1,000 hours. So again, this is being heavily monitored. If you get into the 101-hour max in that 28-day period, you are grounded and can't go out. And yet there's none of that here. We know the concerns with fatigue, yet there is no requirements like this with EMS. So now switching gears a bit over to COVID, this is going to be less physical and more about some of the mental wellness with providers. And this, this lecture is really not about mental health, but I think COVID has been a very unique intersection of our physical and mental well-being. It's caused quite a strain on the system and on the people, both the patients and the providers. There's more calls. Each call has more unknowns with less resources. We've been into some really difficult circumstances and decisions, having to allocate resources unlike ever before. There have been areas of the country that are suddenly having to make decisions based on what resources they have available, like in disaster settings. There's a huge psychological burden. There's this concept of moral injuries, which essentially is just this buildup of continual ethical moral burdens. And then really the only studies that have been done on pandemics of this magnitude were the SARS and then early studies out of Wuhan about COVID. Some of the psychological burden and ethical moral burden has been cardiac arrest prioritization in some areas where they can't get to all of them, so they have to pick which cardiac arrest they respond to. People that are ill or dying in ICUs or in nursing homes aren't allowed to see their families. The providers are coming home tired, concerned, or not even able to go home, which affects their home life. When they did a study in the SARS pandemic, they found that 2/3 of providers had psychiatric symptoms, including anxiety, worry, depression, or interpersonal issues. The study in Wuhan showed that 33% of the staff had sub-threshold mental disturbances, 33% had what would be considered mild symptoms, 22% moderate symptoms, and 6% severe symptoms. So one of the things to battle this that has become very prevalent has been peer support. It's critically important in high acuity cases, MCIs, pandemics. We're really trying to get away from these critical incident stress debriefings that have been shown to not work. We've really got to be finding other ways. And this is essentially other frontline employees talking to frontline employees to help develop a wellness plan. It gives them information and skills for each provider, and it's catered to that provider. Helps them identify and discuss moral injuries, and it helps them be more intentional about self-care in 3 arenas. So we're going to talk about kind of the wellness of home, at work, and on calls. So peer support is something that if your agency is not pursuing, should really start looking at, because it is shown to be very effective. People want this. And those that are involved as peer support staff are excellently trained, and there's great resources out there. So how do we help wellness at home, and why is it important? Well, it's creating structure in the midst of the unknown, which helps create certainty. So certainty that's created at home really normalizes the home and helps the whole family unit, which is so important. You really need to allow time for regular exercise and activities, stay connected with friends and family. Limit time watching or accessing the news if that seems to be one of the areas of stress for you. Inform your family of the latest infection control practices if that seems to be a concern, and then just keep an open dialogue with non-medical family. So this just really comes down to taking cues from your family. I'm married to someone that is not in medicine, which I think is a great asset, but it also means I have to keep that in context and make sure I'm really meeting my wife where she's at and giving her the information she needs, but also not burdening her with things that maybe won't help her. So make it clear to your children, your family, that feelings of any fear or anger about the pandemic, it's not about them, and just really help keep the dialogue open, answer questions, really decide what the boundaries are in your home, but also don't allow work to just infiltrate your home completely. So then once you're at work, they've found that positive attitudes from colleagues is one of the most crucial factors in reducing stress. And this is COVID aside, this is just in all areas of stress. So it's really important to manage relationships proactively with your coworkers. If you're finding that all that's being talked about is COVID, maybe just agree to times to speak about it versus other topics. Avoid constant worst case scenario talk. Allow easy access to relevant information regarding infection control, PPE, literature that's coming out about treatments and outcomes, so that patients and providers aren't, just basing everything off social media or a certain news channel, but some sort of validated science source is very helpful. Our agency actually has a live Google Doc that the leadership is constantly updating, and that's kind of the one-stop shopping for providers to constantly be able to go cite and look at and get their information without there being any question or any sort of ambiguous information. So finally, we got to focus on wellness on calls as well. So often after one bad call, it can be really hard to get back on the horse, so to speak, and go back out onto another call. And so it's really important to remind providers of their experience already and any sort of stress mitigation skill sets they have. So those of you that work in EMS or any sort of emergency medicine field deal with stress every day, and you might take it for granted. And there might be times that in your mind, you're suddenly facing unbearable stress or different stress, but don't forget to use the same tactics that have gotten you through your career so far, through your training. Use that now. Don't forget the stuff you've seen and done, and that at the end of the day, you know the medicine, you know the scenarios, and you're well trained and have people in your agency looking out for you. There are unknowns, but there are also a lot of knowns, and you come in with experience. And it's important to really reaffirm your situational skills. And, if things are getting out of control, really focus on some coping skills. And you might be helping a team member or yourself in this. And that could be visualization, breathing control, attention focus. And then just some ways to decrease stress at work is problem solve. So define the problem, what the goal is, list the solutions that are possible, note the consequences, and then make an action plan based on prioritizing your solution list. And this can often be happening on the way to the call or with the leadership on a call. So now moving forward, what are some possible ways we can be helping our agencies? So maybe finding healthier snacks instead of having a bunch of donuts. Why don't we have some fruit out on the table? Do you have control over what's in the vending machine? Maybe you and your partner, if you're constantly roaming, can look for healthier options. Maybe your areas around will give discounts to the local EMS providers rather than always going to fast food. If you're station-based, can you do some sort of circulating schedule where one of the crews is at the station making a meal? Can you do some sort of meal planning, potluck style, anything like that? Is there a wellness committee or some sort of bulletin board to get latest information up there? One more thing about the meals, there's a lot of different things, because we can always be interrupted in the middle of making a meal, so slow cooker meals are great. Having some sort of cold food that doesn't require cooking, so fruit, sandwiches, cold salad. And then grilling can be done by multiple people. So if you get pulled away on a call, is there a dispatcher in-house that can help you? Is there a supervisor? Is there anyone there that can be, watching the grill while you're gone? Something about the wellness committee and the bulletin boards that's great is you can post articles about nutrition, exercise, smoking cessation, mental health. It might help identify national health issues. And again, that just continues to give objective information to the providers. And it also just helps contextualize things and not make you feel alone, like you're the only one struggling if you are. Employee assistance programs, these are very similar to peer support. It really just helps address mental health, stress, and family problems. It's anonymous. It shouldn't be punitive or have any penalties of it associated with it, but it should be readily available, and it should be very clear how to approach it so that providers aren't constantly having to ask everyone how to do that, because then that kind of removes the anonymity. It's important to share information. So does your agency have a monthly newsletter? Could there be a health column? Could there be a health tip put on the pay stub? You could put information in the bathroom, in the kitchen, any sort of common room, as long as it's, some sort of validated, objective, evidence-based. It's not just some agenda seeking entity, because that will create more stress and not guarantee that you'll be getting good information. You can organize health challenges, have a wellness library. That's often based on how many people are interested. Would they prefer to have a buy-in for the winner? Is there just a coworker you want to have a health goal with and you share a prize, that kind of thing? The wellness library can have workout videos, health books. Maybe people can donate old exercise equipment or weights. And then we've really got to start moving to the peer support and mental health first aid model, and remove this critical incident stress debriefing. So just quickly for me, I work all day and my mind is shot. And so it's very important for me that my physical man as well as spiritual man are both being fed every day. And so that balance comes with fitness, nutrition, cooking, and then being very involved with my church and my faith. Regarding my fitness, for me, it's about just kind of stressing my body, getting some sort of weight training and cardio in with some sort of goal. Every week I have goals of a certain kind, and that's just to compete with myself. My degree of fitness varies on the time of year, and how busy I am at work. If I am not working a lot, then I'm not as strenuously working out, but it's really just the goal is to try and balance how much mental fatigue and exertion is being done, to balance that with physical. There's various ways to measure your diet. I am one that follows my macros. I've tried various intermittent fasting, counting calories, and just with my lifestyle, macros and meal prep is the best. Anyone that's worked with me has seen my little red lunchbox that's full of the same foods I eat every time. I have a lot of thoughts on different types of diets, which is probably its own lecture, but just kind of figure out what works for you. You might be experimenting, trying different things, but you just got to figure out what works for you, because it's very individualized. And then finally, sleep. As we talked about, adequate sleep is really 7 to 9 hours. This is something that I'm not great at. One of the biggest temptations for me is after getting the kids to bed and all the work is done, I'm ready to just sit down for me time. And that me time often cuts into when I should have gone to bed. So my 7 to 9 hours drops to 6 or 6.5, so that I could relax on the couch, which really isn't serving anything when sleep is really what matters. And so as I've gotten older and had more kids and get busier, sleep is really starting to become a me time thing and becoming a priority. So, just in conclusion, you really want to evaluate your agency's mindset, what resources are available, and any perceived barriers. And that will require talking to your staff. You want to make sure that as leadership, wellness is clearly important to you, and you have voiced that to the staff. You want to hear what the staff wants, or changes that you make won't be effective if no one's interested. If you've gotten a discount to the local gyms, but the staff doesn't know that, then they can't use it. Any changes that are implemented should really improve wellness, because this overall helps your agency's efficiency, morale, longevity, safety of patients, safety of your providers, and it even has been shown to save money. And then the biggest thing is know and share resources within your agency and then between agencies. So hopefully that was helpful. Hopefully you guys learned something, and we can just continue this dialogue and try and get wellness to mean more, and we can continue the talk and try and get more studies and just continue to keep everyone safe and increase their wellness.